I'm Janelle Marie, and welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have, of course, plastic surgeon Dr. Joseph Mele. We're talking about a couple different procedures. First up, we'll have arm lifts, followed by liposuction, tummy tucks, and then finally breast augmentation. Of course, before we get started, any advice we give you today, you want to consult your own physician. All right, let's jump right in. Dr. Mele, thank you for joining me again today.
It's nice to be here.
Always fun with you. All right, so we're talking arm lifts, and this is really cool. A lot more people getting arm lifts. What is the technical term for that?
It's called a brachioplasty.
Brachioplasty.
So brachio, arm, plasty, changing.
Changing the arm?
Changing the arm, making it smaller usually. Well, and I think it's become more popular because of the number of people losing a lot of weight.
Yes.
Either through bariatric surgery or dieting, exercising. Sometimes the fat gets stored on the upper arm, and then when we lose the weight, the fat goes away, but the arm skin is still there.
Who else is a good candidate for it besides weight loss? Because, you know, the women always complain about the bat wings. Am I right?
If there's a little bit of fullness there, then something a little kinder, gentler like liposuction may be enough.
Okay.
As long as the skin has enough elasticity to shrink back to the shape that we want it to be. But when it's loose, then we're stuck making an incision there in order to get rid of that extra skin. We just don't have a good skin shrinking ray yet.
I know. Why
I'm still
don't
looking
you?
for it, but
Why don't you?
We look.
All right, well, keep looking.
Doesn't work well.
All right, the scar for the arm lift, because the arm is kind of small. So where are the scars located?
Sure.
And are they?
There's really two primary scars. Some people put it right in the fold, the bicipital groove. I like to put it behind, so it's sort of on the inside of the arm. So it runs sort of from the inner part of the elbow to the back of the armpit.
Okay.
And that way, in most positions, it's pretty well hidden.
So what happens? What about recovery time for the arm lift?
Recovery time, really pretty good. You'd think that using your arms would be hard after that type of surgery, but since the incision's longitudinal movement really doesn't put tension across it.
Okay.
So usually it's a couple days pretty sore, a little swollen. After that, it starts getting pretty rapidly, and most people by a week or two are back to doing what they need to do. I do have them wear a garment, so there's a little bit of a sleeve that goes on there to give some compression.
Tighten it up a bit.
Helps keep the scars flat and keeps the swelling down in the upper arm.
Let's go to pictures. I know we have some good before and after pictures. Here's the first one. Oh, wow.
So there's an example of someone who has like 2 or 3 times the amount of skin they need for their arm.
Yes. Was that a weight loss situation?
Weight loss, yes.
Okay.
And a lot of times they'll say it just doesn't fit in a sleeve still, even though the fat's gone. Or when they're done waving, they want their arm to stop waving. This tightens up that skin, so now it's part of the arm again and not hanging on the arm.
That is really good.
So again, the incision's underneath, so you don't really see it. It's from the armpit to the elbow there. But there is a scar. And for the folks who don't want a scar, it's not a great operation.
No, but the scar will eventually fade.
Yeah, but most of the folks who have this, a scar is a happy change.
Yeah, absolutely. All right, here we go.
So here's someone with a little bit less.
Yeah.
And then you can see, starting from the elbow down, there's that laxity. She has a thinner arm, and again, everything was moving when she stopped.
Oh, yeah.
So this is kind of the other end of the extreme.
Okay.
If someone has less than this, probably not going to be a great idea.
Do you think liposuction for something less than this would work?
The problem with liposuction is it just takes the fat away. So if the skin's already loose,
so we got to worry about the loose skin.
We might not only just get loose skin that's smooth, we might get loose skin that's wavy or irregular. So that would be worse.
Do you have to put people out, or is it?
I do this under anesthesia.
Yeah, under anesthesia.
It's a long procedure. I mean, it doesn't look like it takes too long, but it takes several hours in order to do it.
Here's another one.
So here's someone, and you can see in this case, the skin kind of goes down the side more. Sometimes it'll loop up back into the armpit, sometimes it comes down. And if it comes down, then sometimes I need to do a little Z-plasty or make the zigzag in the armpit so that the arm will go up and down easily. Did not have to in this case, but it's always in the back of my mind.
It's such a good after photo. I mean, that's such a difference.
I should have had her wear her sleeve before, but I couldn't because the sleeve was distorting the skin. It was pulling her arm skin up.
Okay.
She too has like twice as much skin as she needs for her arm.
Because there's always a few, women work out and they always try to get that tricep worked out, but there's always that loose skin and you don't have that nice, let's see, like in the after photo here, that nice curve smooth, back up.
Goes up to the armpit, but it forms to the skin on the arm.
That's really good.
Yeah, I remember the guy in Extreme Makeover having people do those triceps drills saying it will tighten up the skin.
Yeah.
All these folks have tried that.
Well, so is it genetic then?
It's partly genetic, and it's partly how much tissue expansion was there from the weight they had before.
From the weight,
But there are some people just born with extra skin there. And that's hard. There's no exercise that'll make it go away.
There's no exercise.
And it limits, what kind of fashion they're able to wear.
Do you see men coming in for that at all?
I do, again, for massive weight loss.
Oh, that's true.
But men, we tend to put fat in different places.
Yes.
So we don't tend to fill the upper arm as often, but when it happens, we get the same problem with the skin.
Such a pain, those bat wings.
No,
All
we
right.
tend to put it more in our belly, so we're
That's
working
true.
lower.
That's true, man. Keep it in their bellies, women more in the butt. We'll talk about that later. All right, for more information about Dr. Mele, you can call 925-943-6353 or check him out on the web at either drmele.com or sanfranciscobreast.com. Lots more coming up. Keep it right here on Body Beautiful. It's a surprise. What's coming
What's next?
I don't know. We'll wait and see. We'll be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.